Dr. Abate is Assistant Professor of Medicine at Mayo Clinic College of Medicine and Science, and she's also Director of the Metabolic Bone Disease Clinic at Mayo Clinic, Florida, in endocrinology, and she'll be giving us 2 talks this morning. Dr. Abate.
So I'm going to start. I have no financial relationship or any ties with any investigational money. So I want to start with a couple of cases, and just to get your input and opinion about what you think is the correct answer. So the first case is a patient I saw last year, a 43-year-old female on a routine lab, had a serum calcium done, and which was mildly elevated at 10.3. And normal range in our lab is between 8.6 to 10.1. Her serum calcium level range in the past 3 years, mildly just elevated 10.1 to 10.3. Her 25-hydroxy vitamin D was normal, and her kidney function was normal. Albumin was slightly elevated at 5.2. So I want you to pull out your voting. What's the next step? Do you want to measure her parathyroid hormone level? Do you want to measure her PTHrP or parathyroid hormone-related peptide? You want to just see her back next year to recheck her calcium? Or you want to confirm hypercalcemia by correcting calcium for albumin. Okay, so let's see what. Okay, so most of you got the right answer. So the correct answer is you want to confirm her hypercalcemia by correcting her calcium for albumin. I definitely, you don't want to start by assuming this is malignancy by checking PTHrP, and PTH would be, still the correct, but you want to make sure she truly has hypercalcemia because of her generous albumin. And actually, let me go back here. So just a little bit about calcium. So our calcium content in our bodies, about 2% of our body weight. Most of, about 99% of our calcium is stored in the bone, and about only 1% is available in extracellular matrix. So there is a balance between what's in the bloodstream and what's in the bone that's tightly controlled, and that control is by parathyroid hormone. But not all calcium is freely available. It has to be bound to either protein or has to be ionized. So protein is carried in the blood